Hi everyone, I'm Dr. Foote. Nice to have you here today. Excuse me, I'm straightening out my coat. I'm a veterinarian with over 35 years of veterinary practice experience, and I'm also a veterinary animal behavior consultant. And so I provide videos on my YouTube channel, education in not only animal behavior, but also especially less stressful veterinary care, less stressful care for our patients, blending the fear-free program, the low stress handling program by Dr. Civilian, cat-friendly practice, and integrating that with knowledge of veterinary medicine. So welcome to today's Facebook Live. Today I'm going to talk about canine cognitive dysfunction. Okay, I'm going on that senior animal theme, following the last week, the presentation about the AHA senior guidelines and that. So, canine cognitive dysfunction, what it is and what it is not. And it can get to be a little confusing sometimes, what it is. All right, so cognitive dysfunction, what it is really that loss of a learned skill. That's what cognition is. It's like the dog learned house training. He learned how to go to the door or come up to you and give you that look, how to hold his bladder so he wouldn't urinate in the home, to go outside, to get rewarded for passing the urine outside, and then as a habit, it builds as a habit. That's a learned skill. The dog learns to come up to you for a greeting because then they get petted or then they get food. Something good happens for them. True exploring and social interactions is a bit innate in the dog. But to specifically know, like, hi, I come right up to you and I wag my tail, which then gets me a treat, is the learned habit. So this is what cognition is. And so in general, I'll get a little specific here, but in general, when we have cognitive dysfunction syndrome developing in the dogs, what we're going to primarily see is behavioral changes. The behavioral changes are going to primarily be related to anxiety. We're going to see an increase in things like pacing, panting, drooling, whining, these anxiety type behaviors in the dog. They may have been present in their life before, but they're going to get worse. They may have never been present before, and now you see them. Okay, so anxiety is what we're going to see. Or we're going to see compulsive type behaviors. These repetitive things like digging on the couch. They dig, and they're tossing out the pillows. Or they may start licking on their body. We see these acrolick granulomas is a term for it, the sore, from licking on their paw, licking on their leg, licking on a part of the body, which may be compulsive in its nature. Now, there also could be a physical trigger for it. There could be pain in that joint, and that's why they're licking at it. We may see them licking on objects, licking on a pillow constantly, licking on the floor constantly. So compulsive type behaviors will tend to see compulsion go up. Now, the neurotransmitter changes that are happening in the brain as it's aging are primarily related to acetylcholine. There's also changes in dopamine, and there are also changes in serotonin. And so because of the changes in those neurotransmitters and aging of the brain, the cells are dying off. This is how we're losing capacity in the brain. It reflects in these behavior changes. Okay. Now what it is not, the behaviors we see related to pain or inflammation are not cognitive dysfunction syndrome, and it can be a little tricky sometimes to tell between the two. So that's why it's so important for clients and owners, get a video of what your dog is doing, because there's a certain nuances to the way they may hold their body and walk, etc., hold their head up, that may be more related to pain than it is to dysfunction, that, they're losing their learned skills, that cognition, okay? So we need to see it. We also need to take the time and have a longer appointment so I can do a much more complete physical exam, an orthopedic exam, and a gait exam. Then we go outside, and I'm going to say, okay, let's go walk along the parking lot, and I'm going to maybe video as you walk so I can review it again, but I need you to walk a good 20, 50, 60 feet and come back again, and then let's go walk on the grass, and walk on the concrete, and walk on the slick floor, and walk on, where there's some texture. So I can see if there's any difference in how this animal is able to walk on these different surfaces versus stopping and staring and like having to like reorient themselves as compared to, no, my feet are slipping and sliding and that's why I don't want to walk. So pain and inflammation related behaviors are not cognitive dysfunction syndrome problems. And what we tend to see with pain especially is an increase in aggression. When you have increased aggression, really think about pain and inflammation. Okay, the pain and inflammation will make cognitive dysfunction worse, but go after that pain and inflammation. Really focus on improving that and reducing that, because that's how it can reduce the aggression, and it will then ultimately can reduce in the progression of, or how fast the cognitive dysfunction will start to accelerate this in this animal. We will see anxiety related to pain. So that's kind of the same behavior in both cognitive dysfunction as well as pain and inflammation in the aging dog. So we will see a rise in anxiety-based behaviors like the whining and the pacing and the drooling, avoidance. I think we see a lot, in my experience, with dogs that are older, and when it's more about like pain and inflammation, you're going to see them like getting up and leaving the room. So they have purpose in what they're doing. They know what they're doing. They're getting up and they're getting out of the room with the kids that are running around doing cartwheels. They're getting up and maybe they struggle a little bit, but they'll find a way out of the family room when the football game comes on Sunday, because the noise is too intense on them, or people jumping around and moving around, and they have pain from arthritis, which means now I got to move around, so they're avoiding it. So those avoidance behaviors tend to be more related to a pain and inflammation as a behavior change in the senior pet. Okay, now both of these can be going on at the same time, right? They can both be happening at the same time in our senior dogs. And so I feel that it's important to always think of both. You know, sometimes I would drive myself crazy, I don't know, it's me, but anyway, drive myself crazy trying to think like, oh, which is it? You know, is it cognitive dysfunction, or is it pain, or is it an organic problem? And you know what? Both of those wheels are turning in the dog's body at the same time. Now, cognitive dysfunction syndrome, these signs of the anxiety related to that, or the compulsion, tend to really show up in the geriatric dog. I had linked the study here from the Journal of Medical Science and the post on my Facebook page from the physical signs. It's called the Physical Signs of Canine Cognitive Dysfunction. And primarily the signs related to dysfunction, this was, I think, over 700 dogs, you know, people who were from the web survey, and about 700 dogs, you know, answering the questions, that the majority of the dogs were showing gait, they had vision impairment, smell disturbance, tremor, swaying, or falling, all with the cognitive dysfunction syndrome. And they primarily saw this in dogs who were over 16 years of age, and they increased from age 10 and on up, okay? So when you're getting really geriatric animals and then you're seeing a popping up of these behaviors, strongly think of this. Sure, arthritis is going on. Sure, there's other problems going on. But if they're being managed, and like the skin is not chronically inflamed, they're able to get up, you know, they're able to move around, they're not showing any sign of aggression or fast head flip or startle response, then you pretty much have this managed, which means this is the reason why it's going up. Okay, so that helps you a little bit. Which is it? Okay, so why is it important to try to even at least think which one is affecting the animal more? Well, part of it is because of what are the tools we use, what are the supplements, diet, medication we use to help manage cognitive dysfunction syndrome while we're managing the other health problems. So cognitive dysfunction syndrome is progressive. It never gets better. It will always get worse over time. How fast it gets bad over time is a bit dependent on the breed size of the dog. We tend to find the large breed dogs will escalate a bit more rapidly as compared to the toy and the small breed dogs. Secondly, other factors like how enriched is their environment. Dogs who regularly get a walk every day off the property are physically healthier, their heart is healthier, they're getting more enrichment, they're smelling the other smells, they're seeing the other things. They will tend to have a slower onset or slower progression as compared to dogs who just go in the yard. And that the clients are avoiding any kind of regular, moderate physical exercise. Okay, so it's progressive and it's managed. Okay, so ways to manage it are, always manage the physical health. So first one I say is, let's get regular senior-friendly exercise. So a 5-minute walk 3 times a day is as good and as healthy and helpful for the body as one 15-minute walk a day. And especially on our senior dogs, it may actually be better because it's 3 times that they're getting outside and they can smell some of the changes, whether it's the morning with the dew or the afternoon and the sunshine has been on things. Maybe another animal came by and urinated in an area and they can smell that, okay? Changing the direction that you walk the dog for these 3 5-minute walks is very enriching to their brain. Doesn't take a lot of time. If they are having a bit of arthritis or a little difficulty walking around, you're not going to overwear them. So let's make it senior-friendly walks, short and sweet, easy on the body, but multiple times a day, okay? Second thing, stop feeding them out of a food bowl. I want you to feed them out of food puzzles. I'm going to step off camera 1 second. Okay, so food puzzles that are easy, like senior-friendly, easy, but get them to have to do a little something, Okay, so you've seen some of them, the Nina Otten that spin around. Those are fine. The only thing I kind of keep in mind with those is because the dog, especially our larger breed dogs, have to stand in one place, it could get a little tiring on their joints, okay? But you could use those. But what I really like is, I really love this one. I call it the Purple Flying Saucer. It's called the Twist and Treat by Pet Safe. And the reason why I like this one is, I'll get a little closer to the camera. Okay, so it twists. This one is very old. Believe it or not, my Bella never destroyed it. She used this from the time she was a puppy till the end of her life for 13 years. Okay, so you can open it up. Let me get it on the camera. And you can actually take it apart. Pour the food, dry food in here. This will hold about a 1/2 cup to 2/3 of a cup. And then when you screw it down, oopsie, put other things in there too, like peanut butter and stuff. But the little holes here, this keeps it easy so that as they flip it around with their nose, the food will fall out. Now, if they're getting really good with it, then offset it, and it makes it a little more difficult. But this gets the dog to both be using like their nose, and they have to figure out that they got to flip it around, and roll it around, and it moves in a way that isn't very straight line or predictable. So that keeps their head thinking. And I had one client that I recommended this for her 13-year-old golden retriever, and she came back, it was a recheck or something. She goes, wow, he's a lot sharper now. And I said, yeah, it's like people doing crossword puzzles. Okay, so this food puzzle, Twist and Treat, great product. This one's a little bit easier, but this is just to show it's a simple ball. And you could stuff a treat in there, so your dog will have to chew it as well as bounce it to get it out. But that's the point, they've got to work it out. So use food puzzles. Now, if they're having dental problems, or had dental problems and pain in the mouth, we can use more like the canned food that they can lick that out and don't have to do so much chewing. So you have to be mindful of some of those, things with our pets. Other enrichment can be practiced, whatever training that they know. Kind of like, let's go back to remedial, sit, come. Sit might be hard if they've got arthritis, but at least come, stand still. If they know a high five, they can give you a high five, right? So do a little bit of practice of their basic training. Now, as far as diet and other nutritional supplements, okay, I'm not going to talk about drugs yet. I'll talk about the diet and what we call nutraceuticals. The best diet, frankly, is by Purina. It is called NeuroCare. There's another diet also by Hills called Brain Diet. These are prescription level diets. That's also a very good diet, but it may not be quite as readily available as the Purina NeuroCare is. Now, these two diets have been made specifically with the higher levels of what are called a medium chain triglyceric acid. Okay, it's a certain type of fat that is directly feeding the brain cells for the energy that the brain cells needs to be able to function better. Then secondly, there's a balance of B vitamins and other what are called antioxidants, which like remove, it's the easiest way for me to say the junk going in the bloodstream in the brain from this like aging and inflammation on the body. So the antioxidants are helping to remove from within the brain and the circulation this like inflammatory just junk. And that's what kind of clogs up the brain or decreases how well that acetylcholine, dopamine, and serotonin, those three neurochemicals, can work. So when these dogs get on the brain diet or the NeuroCare by Purina, they really literally brighten up mentally. Now, they will brighten up as best they can, depending on how far along they are with the cognitive dysfunction syndrome. If they're really far along, you won't see as much benefit as compared to when they're earlier in this process, okay, in the cognitive dysfunction syndrome. Omega-3 fatty acid supplement. There are a lot of other supplements, like one's called SAM-E. There are some vitamin supplements specifically for the senior dogs that have a higher balance of some of the B vitamin, vitamin E, vitamin C. All of these things, talk to your veterinarian so that you've got the right product, or find a veterinarian that has a lot of integrative knowledge, integrative medicine knowledge about these things. Now, there are also other supplements too that can help to relieve the anxiety. One is called Composure, Theanine, Zilkine. There's a range of them. So again, talk to your veterinarian about which nutritional supplement or botanical can really help with reducing that anxiety. Now, when it comes to drugs, there is one approved drug directly for the treatment of canine cognitive dysfunction, and that is selegiline, or Anapril is the trade name, by Zoetis. Okay, this is a tablet given every day, and that helps to decrease some of the anxiety symptoms and compulsion symptoms that we see with cognitive dysfunction syndrome. Some of the other anxiety-reducing medications like alprazolam or trazodone, gabapentin is a pain reliever, but it also helps to relieve anxiety. It has kind of a dual benefit, as well as tramadol. Tramadol, as a narcotic pain reliever, actually increases serotonin, so you get a dual benefit. These tend to be used on an as-needed basis, unless they're part of a pain management plan, and then they may be on them daily. But there are some pharmaceuticals that are going at a more direct line, a direct line to the brain to change the levels of those important neurochemicals that I spoke about. So we have a much bigger understanding and approach with canine cognitive dysfunction syndrome. There are handouts. Sorry, I should have a table in front of me. Purina website, Purina Corporation has an excellent one here. I'm going to bring it a little bit closer so you can see it. But this one is the Cognitive Dysfunction Syndrome Evaluation Tool. So DISHA, D-I-S-H-A, is the acronym for where we see the symptoms, change in the dog when they are starting to show cognitive dysfunction. So it starts with disorientation. So this is a dog who goes behind the couch and is just standing there like he's stuck. Like he can't figure out how to back up out of there. He kind of wandered over there. Or getting around objects. Like he comes in the living room and he's like, I don't know how to get around that sofa. That is where it can give you, we really need to not only watch, but if you're not sure, take a video, because I've seen sometimes where a dog is come in the living room and then he stops because he's looking around, and we think it's cognitive dysfunction, but what's happening is he's standing on the runner in the hallway and he's looking at a living room that's solid hardwood flooring. And he doesn't want to walk around the hardwood flooring because it's slick and he's got arthritis. How do we know the difference? Okay, let's put another rug or some kind of runner right in front of him and see, can we lure him in the living room? Will he walk in there, easily, or does he still stand there like, I don't know where to go? Because if we put that rug down and now he's like, oh, great, and I walk in there. Okay, no. That's not disorientation. He's having a hard time with the change and the texture of the flooring. So therefore, well, do we have him on his joint supplement? Is he getting his anti-inflammatory? How are we managing safer pain or his gait and mobility? because that's a mobility problem. So in this day and age, boy, everybody's got a smartphone. Take that video, email it, send it directly into your veterinarian. It helps us so much, not only with figuring things out, but also then the progression and the improvement. All right, social interactions. All right, are they irritable? Are they avoiding visiting people? Or like I walk in the door and my dog doesn't come up to greet me, and they may be standing like, oh, hi, are you here now? Like they have that kind of lost look. That's what I hear from clients. He just looks kind of vacant, like he's not really sure. That could be hearing. He might not have heard me come in, but you know, again, we're going to decipher it based on maybe checking, does he hear the can opener open? You know, does he hear other people coming in? But that's how we see changes in social interaction. Just not as interested in greeting, not as interested in playing with another companion dog or person. All right, sleep-wake cycles. We do see this kind of they call it sound downers in humans. I think that's a way to relate to it. But this is where the dogs may be waking up in the night. And they may not need to go to the bathroom. It's always good to let them go to the bathroom. But they may just wake up and start panting and then just lay down. Or it's like they wake up and now they're kind of seeking going into one family room or another. Like they can't remember how to go back down and go to sleep. The H is for house soiling. And learning and memory. So we might see accidents in the home, like they got to the door and then they urinated in the door, or they're not going to the door. They may urinate or defecate. They go outside, if say they've been in a yard, and then they come in and then they have eliminated in the house. Now again, we're going to want to check the urine sample, check the stool sample to make sure we don't have a urinary tract infection. Or more dilute urine, that's harder for them to hold. The dilute urine would indicate we're having a kidney change. But that's where you may see house soiling. Activity. They don't want to play as much. They're not that interested in like getting up and sniffing or on walks or, you know, it kind of relates, the activity kind of relates a bit with that social interaction. And then anxiety. Years ago, the DSHA only had one A. Now we have two A's. They've added anxiety, which I'm really glad to see, because I definitely, you know, get that history of increased anxiety in these senior pets. And again, always that's what keeps me thinking of both of these syndromes going on when we see the elevated anxiety. It's not always just because of the pain. We're also getting brain aging. Okay, so especially separation from owners. I see some of these older dogs showing now signs of separation anxiety. They might chew things up, they might destroy things that they never did before. And it's because they've lost their like anchor to how to know what's going on in life. You know, they believe it or not, they really depend on like what we're doing with our habits to know what to expect, what to anticipate. They can't remember like the day, like the order of the day without that human being around them to help remind them. So they become anxious when they're separated from their owner or separated from a companion pet. You'll see that too with a companion pet may help to kind of keep this older dog like anchored, you know, to day-to-day life. They may be more reactive to fear, to sounds. Sound anxiety definitely increases with pain and inflammation, but it can also be because of this, they can't remember where the sound is coming from. You know, they can't relate to that. And going outdoors in their environments. So you can download this off from the Purina website, and you can go ahead and fill it out, bring it to your veterinarian, or at least do a self-assessment on it. And based on the scoring on it, then you can discuss with your veterinarian about some of these different options. At the very, very least, what you can do yourself at home is increase enrichment. In other words, get your older pet out for a short 3-minute walk out in different sections. If you live out in the country, okay, we're going to go to the part of the yard that's on the north, the part of the yard that's on the south, and the part of the yard that's on the west. Secondly, food puzzles. Okay, get some of the kind of easier food puzzles. And you could even be super frugal and use like a cardboard box and throw some of the dry food in there that your dog may just need to paw open. You could take, you know, an empty cottage cheese container and smear the canned dog food on the inside, where now your dog can have to pick it up and lick it out and figure it out, okay? And then lastly, use your cell phone to record for your own, say how is he doing, is he getting better or not, as well as to share with your veterinarian for progress notes and that. Thank you so much. I do have on my website, drsallyjfoote.com, in the shop, I have it's written for clients. I have a course, a recorded webinar. It's called Canine Behavior and Health at all ages. And the last section does talk a lot about aging pets. I'm going to be putting up another course specifically about senior pet dogs, and a different one about senior cats, and how, like, what are the health issues and behavior, and then how we can help manage this at home. But I really appreciate everybody being here and helping to support our super senior dogs living